neuropathies. It is especially important to look for the presence of systemic disease in patients with peripheral neuropathy. Most patients with coma in a hospital setting have a metabolic, toxic, or infectious cause. So not only the resolution, you have to consider metabolic causes and you have to correct this, and also toxic, you have to treat with an antidote or give something, a treatment, give medications, of course, yeah, and infection or maneuver or yeah, something that could neutralize the toxic products. And the infectious cause is that you give anti-infectious agents, of course, in form of antibiotics or antibacterial agents or antiviral agents. Okay, number 6, drug use and abuse and toxin exposure. Drug use and abuse, okay, that's understood, and toxin. It is essential to inquire about the history of drug use, both prescribed and illicit, okay. Not only the prescribed one and illicit, you should have to ask the illicit drug use. Sedatives, antidepressants, and other psychoactive medications are frequently associated with acute confusional states, especially in the elderly. Obviously, when the elderly takes in sedatives, depressants, and other psychoactive medications, of course, they present with acute confusional states. Aminoglycoside antibiotics may exacerbate symptoms of weakness in patients with disorders of neuromuscular transmission. Really? So be careful when you give aminoglycoside antibiotics. Symptoms of weakness with disorders of neuromuscular transmission, such as MG, may exacerbate the neurologic symptoms. How it may cause dizziness secondary to ototoxicity, and may cause also dizziness. No? Okay, vincristine and other antineoplastic drugs can cause peripheral. Vincristine and other antineoplastic drugs said can cause peripheral neuropathy, and immunosuppressive agents such as cyclosporine can produce encephalopathy. Again, those that can cause peripheral neuropathy are vincristine and other neoplastic drugs, while for encephalopathy, the one which can cause or immunosuppressive agents such as cyclosporine. Okay. Okay. Don't forget peripheral neuropathy, antineoplastic drugs such as vincristine also. And for encephalopathy, immunosuppressive agents. Okay. Excessive vitamin ingestion can lead to disease. Examples include vitamin A and pseudomotor cerebri, or pyridoxine and peripheral neuropathy. Don't forget excessive vitamin ingestion. Vitamin A and pseudomotor cerebri or pyridoxine and vitamin A and pseudomotor cerebri. When you take more excessive vitamin A, you can have pseudomotor cerebri. Or if you take excessive pyridoxine, then you'll have peripheral neuropathy. Many patients are unaware that over-the-counter sleeping pills and diet pills are actually drugs. Alcohol, the most prevalent neurotoxin, is often recognized as such by patients. And other drugs of abuse such as cocaine and heroin can cause a wide range of neurologic abnormalities. A history of environmental or industrial exposure to neurotoxins may provide an essential clue. Consultation with the patient's coworkers or employer may be required. Okay, so don't forget, alcohol is the most prevalent neurotoxin, obviously. And of course, drugs of abuse such as cocaine and heroin are, of course, not excused also. History of environmental or industrial exposure could also give a big clue. So, You have to ask the coworkers or employers about this. Number 7, this is about formulating an impression of the patient. Use the opportunity while taking the history to form an impression of the patient. Okay, is the information forthcoming, or does it take a circuitous course? Is there evidence of anxiety, depression, or hypochondriasis? You know what's anxiety, you know what's depression, and of course hypochondriasis. Okay. Are there any clues to problems with language, memory, insight, comportment or behavior? Okay, the neurologic assessment begins as soon as the patient comes into the room and the first introduction is made. Obviously, why? This is when the patient, how the patient walks, how the patient carries himself or herself, the gait, of course, the facial expression, the facies, the mood, yeah, and then the movement, the overall movement. And when the introduction is made, if he or she can speak, or if somebody speaks for him or her, and as far as the patient, if the patient manifests anxiety or depression,